Hi, Dr. Garima here again, and we'll be shooting today another Australian Dental Council exam question. This is a very interesting question. I really like this question because for all those dental graduates who have not yet gotten exposed to a host of variety of patients, this video is going to give you a glimpse of what sometimes some patients do, and you will at least once in your lifetime end up with such kind of a patient. It's it's annoying to have such kind of patients, but then you should know how to handle such cases professionally. So I'll just give you a gist of what the question is about. So basically, what has happened here: the patient is trying to get the treatment done and put the bill on somebody else, basically committing a fraud. Yes, there are some dentists who help patients with that because they get the money and the patient is also not paying, so who cares? But this is not how a professional dentist should do. So what has happened in this question is that there's a 45-year-old lady who's presented to your clinic requesting implant restoration for 2 missing teeth. Okay, she's saying, I want implants for 2 of my teeth which are missing. Now her medical history revealed that she is hypertensive, which is okay. She comes to get this treatment done as a part of work compensation covered because she slept while she was doing duty on work and lost those 2 teeth. That is what she claims. So basically what is happening here is that the patient has blamed her workplace, and so if you have any injury while on duty at the workplace, then the workplace is supposed to give you money to get treated for that injury, right? So what she's claiming basically is that when she was on duty, she slipped, and because she slipped, she fell, and those 2 teeth completely broke and had to be removed. Now she wants an implant in place of those 2 teeth. Okay, she has seen another dentist already and who's ready to make an insurance claim stating that the teeth which she lost and requires an implant as a substitute for it happened because of her injury at the workplace. But when you checked her dental history, you realized that those 2 missing teeth were not the result of her injury at the workplace, but she's trying to cover that to gain insurance compensation because otherwise she wouldn't have money to pay for an implant. So maybe some injury happened at the workplace, but that is not the same injury as what she's claiming that happened, which you realized after examining her. But she says, and she actually admits to that the injury for which she wants an implant actually did not happen at the workplace. But so what? The other dentist is ready to cover it in the insurance anyways to help me out. Why can't you do the same? So that is what the question is. Get it? So, question: her dental condition is not a result of the recent injury, but she told you that another dentist is willing to cover it nevertheless, so that the patient get a compensation for her dental treatment. She shows you a slip in which this was written. How would you handle the claim? Okay, so the patient comes to you and say, if that dentist can do it, why can't you? Anyways, you are gaining money by doing the treatment. I don't have to spend anything because my workplace is compensating it. So basically a fraud has been committed under a different name and nobody gets sued. So what do you do in such scenario? Do the same thing as what the other dentist did to avoid reputation damage. Report the dentist to AFRA. Contact the other dentist and inquire about the whole thing. Report that to Work Cover Australia. Refuse to cover the work which was not due to the fall in the insurance bill. Report the dentist to ADA, that's Australian Dental Association. Do the same thing as what the other dentist did to avoid reputation damage. Should not be done. Okay, you are not following a certain dentist, you're following dentistry. Always be mindful of that. So you're not going to do what anybody else is ready to do. Report the dentist to AFRA. It's none of your business, honestly, to report anybody unless you actually see some gross negligent work happening, which is harming population at large. And the conduct and the code of ethics also, which is shared by the Australian Council, is mentioning that unless a gross negligence is happening at the part of some dentist which you become aware of, only then you report. Otherwise, for such issues, it's actually none of your business what the other dentist and the patient is doing. So long as you're not seeing any negligent work which is harming the health of the patient is happening. Contact the other dentist and inquire about the whole thing. Now, this from all these options is the most professional. You can, because you know some dentist has written the slip, a wise decision is to contact that person. Now, example, you may think, why should I be contacting a person? Now, imagine if that dentist was your friend, okay, you knew that person, you probably studied together, and you come across a slip like this. Would you report that dentist to anybody else before just calling and asking him, what is the scenario? Like, maybe there's another side of the story that there is there, which you don't know because the patient didn't tell you about it. So you are always going to call the dentist and confirm that side of story if that option is given in this scenario. I know there are other professional questions which I have discussed in which there is, let the patient go back to the dentist or get the records from the other dentist after the patient has signed on the record forms. Every case is different. You cannot just deliberately, forcefully put an option on each of the cases which are different and the same option on them. So in this particular scenario, amongst the option that is given, my first option would be contact the other dentist. Report that to Work Cover Australia. Again, that's none of your business. You should not be doing that. Refuse to cover the work which was not due to the fall in the insurance bill. Yes, that is your right and you can do that. So after the option of contact the other dentist, I'm going to go and choose the option of refuse to cover the work. So both of these options are correct. In your exam, you can choose either of the options, but on the priority basis, I'm going to choose contact the other dentist. Report the dentist to ADA again. No, you're not going to report anybody. You don't know even if that slip is right or wrong, or the patient has fabricated it for God knows what reason. So you cannot just go on reporting any person to the association. You have to first see what actually is true, and only some negligent work is being done, then only you report, otherwise you don't. Okay, that's professionalism. And you have to mark the professionalism questions correct. If you mark them wrong, I think they have more weightage about the other questions to pass you in the exam or not. Which location in the mouth has the highest failure rate of dental implant? Now, this is a basic dental question. It's not related to this scenario. So I could have asked this question in any of the questions that are there in the mock exam, correct? So which location? I know there's a lot of confusion on this, but trust me, I've asked many implantologists. I've myself gone and opened that book, Fish or something, which is their golden book of implants, and it does mention anterior maxilla. I know it seems like a very simple place, but anterior maxilla is the region where there's highest failure rate of the implant. This you have to memorize, so put it in your notes in a book which you memorize it and revise it on a weekly basis. You all do prepare notes, right, of important things which you have to memorize. You have to write it down and you have to read it once a week so you memorize it. By the end of your course, whichever course you're following, you should have this thick book of all the important points that you have written. All of the following are anatomical considerations for implant placement except. So the question here is asking that you will take care of the following anatomical structures while placing an implant, except one anatomical structure, because probably it's not important, or it's really far away, or it's not at the site of implant placement. So which usually is that structure which is not usually at the site of implant placement? Sinus is important, foramen is important, inferior alveolar canal is important. Greater palatine artery is not that important because it's 1 centimeter away from the palatal root of the 6 or 7, between 7 or 8 or 6 or 7 or something like that. You never go that deep in the palate and place an implant. The implant is most probably placed in the buccal bone or a little bit towards the palatal bone. It doesn't go that deep into the palate where the greater palatine artery passes. So that's straightforward answer. Simple question, simple answer. You should be very happy when you get such questions. Now, which of the following does not form around an osseointegrated dental implant? What do you understand by the term osseointegration? Osseointegration means you have placed an implant. So let's take the normal tooth. There is tooth, there is cementum, there are periodontal fibers which attach the tooth to the alveolar bone. The periodontal ligaments are very important. It's because of them the orthodontic treatments are done, and they are the ones which hold the teeth. That is why when there is periodontitis, basically destruction of those periodontal fibers, the tooth becomes wobbly and it loses, and avulsion is an acute form of periodontal injury where all the fibers are torn away and the tooth just falls off. Get it? In osseointegration, when you place an implant, there is no cementum, so periodontal fibers cannot form. So the ideal success of an implant is that it has to stay in the bone, so there should be a direct bone formation over the implant. Since there is no periodontal ligament formation, there is no orthodontic treatment possible over implant, correct? So osseointegration means bone is directly attaching to the implant. If it fails to do so, then it's nothing but peri-implantitis and a direct implant failure. So which of the following does not form around an osseointegrated implant is periodontal ligament, right? That is the answer. So connective tissue will form, junctional epithelium will form, but a periodontal ligament will never form. Bone is the ideal thing that we want to form. Now minimum space required for 2 implants of 3.5 mm diameter is. Very interesting question. I have made a video on this approximately 1.5 years ago, and I thought, why not I replay the same video for you all to understand. One of these questions always comes in the exam, okay? So you need to understand how this is calculated. So I'm going to place my video. If you have already watched that video, great. You can skip, and this video is almost done. But if you haven't, just go through this. So I'm again playing that video. Yep, that's me.
Hi, just discussing quickly before my last question comes in for today, this important question which is I think asked in almost every ADC exam regarding implants. The question would be something like you need to place 2 implants in a quadrant, so what should be the distance total, or rather how much area would you require to place 2 implants rather, and the diameter of each implant is 3.5 mm. So how do you calculate? You have to understand some basic things. So this is one implant, this is the second implant, and there are other teeth next to it. So the diameter of each implant is 3.5 mm. So total space required is calculated like this. The diameter of each implant, so 3.5 mm plus 3.5 mm becomes 7 mm. The distance between the implant and a normal tooth which is present next to it, the adjacent tooth, should be minimum 1.5 mm. Okay, so now 1.5 mm on this side and 1.5 mm on the other side. Okay, so there is a tooth, there is an implant, then there is an implant, and then there is a tooth. So the distance between the implant and the tooth is 1.5 mm on either side, so it becomes 3 mm. So already the diameter of your implant is 3.5. So 3.5 plus 3.5 becomes 7 mm plus 3 mm, that becomes 10 mm. Now the distance between the 2 implants is 3 mm. Okay, so now how your calculation would be: distance between the tooth and the implant 1.5 mm, the implant itself 3.5 mm, distance between 2 implants 3 mm, another implant diameter 3.5 mm, and the distance between the implant and the tooth is 1.5 mm. So total it will become 13 mm. So that should be your answer. The question will be almost always the same, but in case it's a different question, maybe they can ask for 3 implants, 4 implants, or just 1 implant. Then just remember this formula. Summarizing once again: tooth implant distance 1.5 mm, implant to implant distance 3 mm, and again implant to tooth distance is 1.5. So this is how you calculate. I hope that is.
So I hope this is clear now, and you will remember, just make sure you read the diameter of the implant that has been mentioned. And I'm going to rush to get my son from the nursery, and have a nice day. Bye bye.